The first thing you need to understand is that my father was a very controlling, authoritarian person. If I would say, well, I like da 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 da, he'd say, no, you don't. I will tell you what to like. And I would say, well, I think, he said, no, you don't. I will tell you what to think.
Hello, everybody. Welcome to another episode of the Deluxe podcast, where we're on a journey to find out the truth about psychedelics and plant medicine, to get rid of the myths and to change the narrative. I'm your host, Scott Mason, and do we have a one-of-a-kind guest with us today? We have had a lot of notable people on this show, but today's guest is truly someone special. I've been so excited about this. His name is Dr. David Nichols. Dr. Nichols' work with psychedelics began in 1969, and since then, he has been at the forefront of research and innovation in this field all over the place. Dr. Nichols is the previous holder of the esteemed Robert C. and Charlotte P. Anderson Distinguished Chair in Pharmacology at Purdue University. Dr. Nichols has authored hundreds of research papers that have expanded our knowledge of psychedelics and their potential applications. Believe it or not, what I've said is just the beginning. Dr. Nichols' contributions include patenting the method for synthesizing the optical isomers of psychedelic amphetamines, coining the term entactogen to classify a unique category of psychoactive substances, and serving as the founding president of the Hefter Research Institute, which notably funded the landmark psilocybin studies conducted by Johns Hopkins University and NYU. Dr. Nichols also made the psilocybin used in those studies, as well as the MDMA for the MAPS Phase 1 and Phase 2 post-traumatic stress disorders trials, and the DMT for Rick Strassman's series of 1990 studies, prominently featured in the book DMT, The Spirit Molecule, and the film by the same name. Anyone who has a bio like that is a true honor to be interviewing on this show. And so, Dr. David Nichols, I say to you with a very full heart, welcome to the Deluxe podcast.
Nice to meet you, Scott. Nice
Thank
to be
you.
here.
We are thrilled to have you. So, the theme of the day is making a stand for the truth. Dr. Nichols, as anyone, like I said, who just listened to that bio can tell, is a true pioneer. And as we all talk today about his life and his legacy, we're going to be inspired by and understand someone who was willing to truly take that stand for truth. Dr. Nichols, let's start at the beginning. How did you first get involved in the world of psychedelics?
Well, I always was interested in chemistry. And I actually had my room in my house where I grew up. Half of it was a laboratory and half of it was my bedroom. And I did a lot of just routine, mundane chemical experiments there. Um, and then after I graduated from high school, I had a number of friends that moved away to the University of Kentucky. And my parents didn't have enough money to send me away anyplace, so I lived at home and commuted to the University of Cincinnati. But my friends would come home from the weekends, and they went to University of Kentucky in Lexington. And they, at one point, came home and started talking about smoking marijuana, which kind of upset me. I thought, boy, that's dangerous stuff. And then acid, I didn't even know what that was. And so I was concerned. So I got some used pharmacology books from a library, a used bookstore in Cincinnati, and I started reading. And I read about marijuana and I thought, well, this is a complete hoax. This stuff isn't dangerous. Everything that I believed is wrong. And so then they started talking about LSD was making a big swoop through University of Kentucky, and the federal agents were coming through. They thought it was being infiltrated into campuses by the Russians to pervert the minds of our youth or whatever. So I became very curious about it. And then one of my friends said, "Well, would you like to take some LSD?" So, well, yeah, sure. It sounded pretty interesting. And so I took that, and he put on some sitar music and put all the light bulbs, changed them all to green. And I laid in a chair and went through this experience. And it was really something that I mean, it was a unique experience. I mean, anybody that's taken psychedelic knows these things produce an experience that you don't experience any other way. And in that experience, I was projected outside the known universe into basically infinite nothingness. And the universe was this little green glow off in the distance that was pulsating with life. And I had the impression that the function of the universe was to serve as a womb for life. And at the same time, my father was a fairly authoritarian, controlling person. And I thought he'd come out of a very broken household, in Appalachian, basically. And I thought, boy, if my dad could take this, it would really heal him. So I became really impressed early on. And then I smoked some marijuana. I thought, well, yeah, this isn't bad. So at a certain point, one of my high school friends that was going to UK came and said, can you make LSD? So I looked up the way to make it. And I thought, this is beyond my chemistry skills. I'd have to get some ergot alkaloids. They're really expensive. And I have to work with small amounts. And I just wasn't capable of doing that at that time. But then I found the formula for making mescaline. And he said, yeah, make some mescaline. We haven't taken it, but it sounds really interesting. And I figured out a way to make it. And the starting material was $28 for a 100-gram bottle, which eventually allowed me to make 7 grams of mescaline. And I just sold it to him for what it cost me for the starting materials. And he said, don't you want to keep one to take it? I put them in capsules for him. And I had 28 capsules. And I said, no, I'm not really interested. And he said, no, you need to take one. And a couple weekends later, he came up and gave one to me. And we went out and they drove us over to a bar in Cincinnati that's right across the river from where I grew up. A little jazz bar with African Americans mostly in there and musicians. And I sat there under the effects of the mescaline listening to jazz music, which I didn't care for originally. And it was just a really amazing, wonderful experience. So that got me kind of interested. And then I was working, I eventually dropped out of chemical engineering where I started because it was just math and I was interested in chemistry. I wasn't interested in math. So I got jobs working as a laboratory technician in a variety of companies in the Cincinnati area. And the last place I worked, the fellow I worked for, and I was going to night school, going to University of Cincinnati in their evening college division to get my bachelor's degree. And so I was going to school 4 nights a week from 6 to 10. And I did that for 5.5 years to finish my bachelor's degree. And in my last year, the fellow I was working for in the foods biochemistry division of a major company said, you should go to graduate school. Well, I had no idea what graduate school was. I had only been focused on getting my bachelor's degree as an undergraduate. So he told me about it and what was involved and helped me apply. And I had to take the SAT and the GRE and different tests. But anyway, I got admitted to University of Iowa. And I was interested at that point in time in working with psychedelics, but there was nobody doing research in that area, and at least not chemistry wise. So I found a guy at University of Iowa named Joseph Cannon, who was the head of the division there of medicinal chemistry. And he was working on compounds related to atropine, which is in local weed and basically makes you crazy. And it wasn't a psychedelic, but I thought, well, it's similar, so I'll learn something about him. But then when I went to interview and actually join the division there as a graduate student, he didn't offer me a project in that area. He had stopped working in that area and offered me a project working on what were called apomorphine analogs. And apomorphine is a molecule that you get if you take morphine. Everybody's heard of morphine. It's a painkiller. boil it up with hydrochloric acid, and it undergoes a number of chemical transformations and goes to a molecule called apomorphine. And apomorphine, if you take apomorphine, it makes you vomit violently. So I thought, boy, this is a drug that makes you throw up. I couldn't imagine why you would want that. I think maybe he had a grant from the Defense Department. And he thought you could spray this over the troops and they'd all be vomiting and they wouldn't. I'm not really
too vivid
sure.
to even think about of an image.
But anyway, so that wasn't really appealing because that isn't what I was interested in. And all the literature that was printed on this field was basically printed in German. I came out of Germany. I had to take reading German for my bachelor's degree in chemistry, but I didn't have any real facility for foreign languages. So I had a lot of difficulty with German. I thought, boy, I'm going to spend the next couple of years, everything I read is going to be printed in German. I'm going to have to translate it and understand it. And I'm going to be making these molecules that make people throw up. And that just didn't sound very exciting to me. And he'd applied for a fellowship. After Sputnik went up, they started a National Defense Education Act, NDEA, and I got a fellowship. It was for promoting and funding STEM, people who were getting training in STEM, science, technology, etc. So I had a fellowship, and he said, now, although we've communicated, you can work for anybody in the department you want to work for. So there were two other faculty there, and the one I talked to was Charles Barfneck. And he had a student extracting oral contraceptives, birth control, basically, from natural products. Another one was making some novel drugs for treating inflammation. Then he had one student who was working on what he called mescaline metabolites. Well, I knew what mescaline was because I'd made some and taken it. So I thought, mescaline metabolites, that's really interesting. Tell me about what he's doing. So he started talking about the student's research. And it turns out the student had started a big fire using a reagent called lithium aluminum hydride, LAH. LAH is a really powerful chemical reagent for reducing things, but it's also flammable if you put it in contact with water or catch fire. And the reactions that use LAH are done in diethyl ether, which is a notoriously flammable solvent. So this student had done a large-scale reaction where he'd taken 1 or 2 liters of anhydrous dry diethyl ether and had put in several grams of lithium aluminum hydride, and it started a fire because it gives off hydrogen gas, and he'd been using a stirring motor that was not sparkless, it produced sparks, it caught fire. So there was a big fire in this fume cupboard that he'd been working in. So as a result of that, the department had passed a regulation that nobody could use more than a certain limited amount of this reagent in the reaction, and he far exceeded that. So Dr. Barfneck was telling me that he'd done this reaction, he'd reduced it, but he'd started a big fire. And I said, well, why did he use LAH? And he said, well, how would you do it? I said, well, there's a simple reagent called sodium borohydride. You can do it in ethyl alcohol. It's not flammable. It works really well. And that's what I would have done. And so he's taking notes down. So he started talking about psychedelics. He really didn't know as much about psychedelics as I had, because once I found out about him, I read the literature. There wasn't that much. There was older literature, but I'd read literature. And the most recent paper was published in the fall of 1969 by Alexander Sasha Shulgin, who was a famous, this kind of a designer drug chemist on the West Coast. He published a paper in 1969 that had summarized all the work he'd done in the previous 5 years, making psychedelic molecules. And I had read that paper, and I knew chapter and verse, everything he'd sort of done. So when Barfneck started talking to me, I could really I could realize what direction he was going to go in, and I could finish his thoughts. So he very quickly realized that I knew a lot about the field, more than he did, in fact. And I had a fellowship, which meant I wouldn't cost him any money if I decided to work for him. So he said, well, yeah, you could work for me if you want to. What do you think about that? I said, yeah, that's great. And so I decided to work for him. And he basically turned me loose in the lab, let me do pretty much whatever I wanted. I'd tell him what I was going to do, and he would say, yeah, that sounds like a good idea. Go ahead and do it. And he'd come in the morning with a big cup of coffee. He was a Green Bay Packers fan from Wisconsin. He'd come in with a big cup with the Green Bay Packers logo on it. He'd come in and say, well, what's going on today? And I'd tell him, and he'd sit and chat for one. He'd go back to his office. And basically, I would do a project, I'd write it up, and I'd go in and say, I'm thinking of writing this up as a paper. What do you think? Oh, that sounds like a good idea. So basically, he was seconding most of what I was saying. Wow. And if I ran into a problem, of course, he could help me, but I really knew more about this chemistry and about psychedelics than he did. So I finished up within less than 3 years. Most PhDs took 4 to 5 years anyway at that time. I finished up, and within in the summer of '72, he came and said, "You need to write your thesis up." And I had done a lot of work because I'd been a technician in working in industry in Cincinnati. I was very versatile in the kind of chemistry I could do. I typically would have 2 or 3 reactions running at the same time. I would keep a laboratory notebook for each series of compounds I was working on, so I could, keep them straight in my mind. And so I was very productive. I think I published 14 scientific publications while I was a graduate student. But he came in the summer of '72 and said, "You need to write up your thesis and get out of here. You've done plenty." And I said, "Yeah, I'm trying to make this one compound. I was trying to make a hybrid of sort of a hybrid between LSD and mescaline, combine the two structures and come up with something that would be a hybrid. And I was trying to make that as my final compound, and I had some trouble. And I said, I think I'm real close. Let me try this." He said, "Okay, well, you can work a few more months, but you need to think about writing up your thesis." So then I tried to make that. I actually got an intermediate to crystallized, and I made the mistake of trying to recrystallize it. I could never crystallize it again. And that sort of ended that project. So he finally came in the fall and said, "Look, I know you've been trying to get this compound, but you need to just wrap up your thesis and write it up." The thing I didn't really realize at the time, I thought he was trying to push me out the door, but it was because my fellowship had run out in 3 years, which was the summer of '72.
Right.
And so he wanted me out because he didn't have money to support me.
Right.
But
Right.
I didn't know that. So I spent the fall semester working as a technician. They got what's called an NMR machine, nuclear magnetic resonance machine, that you use for elucidating the structures of molecules. So I was the technician that was running that machine for other students in the department in the fall of '72. That's how I supported myself. Wrote my thesis up and then defended my thesis, I think, in January of '73.
Talk to us a little bit about that thesis, and how did you decide to make this particular field your life's work? Or had you decided it by the time you went into the thesis process?
So that was really interesting because I wanted to work on these. And of course, nobody else that I knew of, I looked in the literature, nobody else was doing it. So I thought, well, I can do this. And then the year after I started in 1970, Nixon started the drug war and made all these drugs illegal. So as a graduate student, I thought, well, I've had a lot of fun making psychedelics or hallucinogens or psychotomimetics, as they were called. And I've had a lot of fun for 3.5 years, but I guess I'll have to do something else. And Barfneck had gone out and he'd found there was a position they were looking for a medicinal chemist at a company that was making oral contraceptives. And so he said, they want to interview you because, I'd said you're a good student on. So, well, that was a big shift. Well, it turns out that Barfneck and Cannon both had been collaborating with the head of the pharmacology department at University of Iowa, a guy named John P. Long, J.P. Long. And he'd had a student that was working on some of the psychedelics and had wanted one compound to finish his thesis. And he was working on his master's thesis. His name was Jim Engelbrecht. And he needed one more compound to finish his master's thesis, but he hadn't been able to get it. And I went over and asked him to test some of my compounds in mice, which is the animal species using. He said, "I could do it if I had this other compound. I could finish my own thesis, and I'd be happy to do things for you, but I need this compound." It turns out the student had done the LEH reaction and caused a big fire, had been trying to make the compound for him. So I went back to talk to the student. I said, "What did you do?" And after a brief discussion, it turned out that he'd been totally screwing the chemistry up. And so I went in the lab and I made the compound. I made a big bottle of it. I made like 10 or 15 grams of it. And I crystallized it. And if you've ever seen, what rock candy is, big rock crystal candy.
Of course. I love it.
Crystals look like that. And so I had it in a big bottle. And I knew he'd been wanting this really badly for like over a year. And he was stymied in finishing his master's thesis because he needed this last compound. So I took over a big bottle that had 10 or 15 grams. He only needed like 50 milligrams. And I took a bottle over that had, 15, 20 grams, a big brown bottle. And I thought I would make a funny, humorous label. Back in those days, they didn't have word processors. They had these what are called rub-on letters. They were plastic sheets with printed chemical structures, and you'd lay it over a piece of paper and you'd rub on it, and would transfer off into a piece of paper. So you'd get these nice, hexagons and so forth.
Mm-hmm.
So I made a label for the bottle. I put the name of it on there, what it was, the structure, and I put the number of grams. And then as the manufacturer, you'd have that at the top of the label. I put Sheer Grace of God Chemical Company.
So
So
you had a sense of humor about it,
yeah.
at least.
So I was walking over the pharmacology, the medical school was right next to the pharmacy building. I was walking over to give this bottle to Jim, and I met JP Long in the hall. I saw, oh, JP. And this was around the time I was finishing up. I was thinking what I'm going to do. And I had been kind of a pharmacology groupie. When I had reactions running and I had time off, I'd walk over to the medical school and go over to JP Long's lab and was watching what they would do. How do they work up the animals? How they do injections? How they prepare the tissues? So I was kind of a pharmacology groupie while I was a graduate student in medicinal chemistry. So I gave this bottle to JP Long. I said, I think Jim is waiting for this compound. This is the last compound he needs. And I gave it to JP, and he picked it up and he read that label, Sheer Grace of God Chemical Company. And he knew that it had been a miracle to get this compound, basically. Mm-hmm. And he gave out this big laugh. He was a really humorous guy that smoked cigars and spit the butts on the floor and everything. He was kind of an, interesting guy, but very funny. And I said, I've been thinking of doing a postdoctoral fellowship in pharmacology. Do you think I could work in your lab? And so at that moment was the precise right time to ask him. And he says, well, I think we can find something for you. So I finished my PhD in like January of 73. And then I moved right over to the medical school in the pharmacology department and spent almost 2 more years there doing a postdoc in pharmacology, learning how to work with mice and rats. I wrote some computer programs. Back in those days, they didn't have microcomputers. So if you wanted to analyze your data, you had to get what are called punch cards. I don't know if you've ever seen these, the old days, computer punch cards. And you'd have to punch out all your cards. You'd take a deck to the computer center and they'd feed it in the machine. So I wrote a couple of programs. They had just gotten an HP, I think it was a 9810 programmable calculator. And you could program it in basically in BASIC, and it also had a flatbed plotter that could plot things. So I figured out pretty quickly how to use it and how to plot graphs out. And so you could just type in your data and it would plot out dose response curves on a big plot that were suitable for publication. They were publication quality. So I wrote programs for all the assays that were being done in JP Long's lab. And all they had to do was go sit in, load the card in, type in their data. And so I did some of that. I learned how to do pharmacology, worked on rats. I did an experiment looking at a couple of compounds that were called MDA and PMA that were known to be toxic. Some people had overdosed. So I measured their effects in mice. What did it do? Their body temperature? How did it make them active? I also worked on cats a little bit. So basically became a pharmacologist for almost 2 years after I'd done medicinal chemistry. And then I started looking for a job. And jobs were pretty hard to get then. I remember the Daily Iowan, which was a school newspaper. They had a story of somebody who'd been looking for a job. He'd been applying for a year, and he had papered his dorm room with rejection letters, all the places he'd written to looking for jobs. So jobs are kind of hard to find. So it turns out that Purdue University, in their medicinal chemistry and pharmacology department, they'd had a senior faculty member there that had left on a sabbatical and had not come back. So they decided to replace him. So they actually had interviewed my professor, Charlie Barfneck, and some others for this position. But after they interviewed all these people, they decided they didn't want to go with a senior level person. They thought they could take the money from that other person. They could break it in half and hire 2 junior faculty. So Barfneck came to me and said, they're going to be hiring a junior faculty in that position. You ought to apply. So that's what I did when I was finishing up my postdoc. They wanted somebody at Purdue that had a good medicinal chemistry background, but also had a lot of biology background. So I was just what they were kind of looking for. So I interviewed for the job there and started in the fall of 74 as an assistant professor of medicinal chemistry. And then I just kept doing the same thing I'd done as a graduate student for a couple of years. I just worked in the lab. I worked on mescaline analogs, modifying the structure of mescaline and some related compounds. Did that for a couple of years, didn't know anything about grants until one day the department head, Heinz Floss, came in, and I kept going up in the lab between classes. I was teaching classes to the pharmacy students, so in between classes, I'd be up in the lab working myself. And I recruited some undergrads to work to do research with me. So I had 3 or 4 undergraduates in the lab, all working basically on psychedelics, mescaline analogs mostly. So the department head came one day and said, this is not efficient. You need to get a grant. It's not a cost effective for you to be in the lab. You need a grant so you can hire people to be your hands in the lab. So then I did. I wrote grants, and then I got a grant. One of my grants was from the National Institute on Drug Abuse to study psychedelics, and I had that grant and renewed it for 28 years, 29 years while I was at Purdue.
Wow. Well, that raises an interesting question, and it actually ties back to one of the early statements that you made as you went through your personal history. You said that even when, before you really officially became an expert in this, as you were first studying chemistry and first learning about psychoactive compounds as well as cannabis, you said that you heard the propaganda or heard what was being said about them. Then you did your own reading with an understanding of, even at that level, I assume, sophisticated understanding, especially compared to a layperson, of chemistry, and you realize this wasn't true. And so then you ended up trying it. And later, then you are in the middle of your work, and Nixon announces a war on drugs. And there are, again, all of these propagandas that are being thrown out there that inside you have to have known wasn't true. And here you are studying these exact substances, even if it is really, as I'm hearing it, mescaline, really focus on one. Now, I understand that the source of the grant was, the National Commission on Drug Abuse, but how did you feel about being able to truly study under these grants, particularly if some of your studies were showing positive possibilities for them in light of the stigma that all of this language, which you knew was untrue, was out there? How did you navigate that?
So the first thing you need to understand is that my father was a very controlling, authoritarian person. If I would say, well, I like da 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 da, he'd say, no, you don't. I will tell you what to like. And
Wow.
and I would say, well, I think. He said, no, you don't. I will tell you what to think. So I became
Gee
very
whiz.
anti-authoritarian.
I bet you did.
And so working in an area that was frowned upon didn't bother me because I'd done things. I made explosives with my lab, and I blew things up, and my parents never knew about it.
Well, wait, we'll have to do a whole other episode about that sometime.
My mother, we blew up a fence post that was down at the corner. There was an old farm there. There's an oak fence post that I put a bomb in there and blew up the fence post. And my mother said, David, do you know anything about that? No, mother, no, I don't know anything like that.
Doctor, I just have to interrupt here. You come across so mild-mannered, and you're not boisterous, and you seem you are completely sane and rational and very almost like linear in your thinking. And then I'm here and I made bombs. You just casually have spit out there. I made bombs. Okay.
So
that is anti-authoritarian. Dude, I love people that are so much more than they seem. You fall into that category.
The way you get away from getting in trouble is by being completely innocent, nobody suspecting that you ever did. That's the way I live with my father. If something happened, I had to make sure that my ass was covered. CYA, right? Cover your ass.
Hey.
So,
boom.
So anyway, but I really, with the LSD and the mescaline experience, but the LSD experience more than anything was so powerful to me. I mean, imagine the universe is infinite in size. Now we can say infinite, but what does that mean when you say something is infinite? Even today, I can't really imagine, but the universe is infinite in size. And so I was projected outside of the known universe, looking at this little green glow of pulsating stars and galaxies, realizing that the function of the universe was to serve as a womb for life.
Yeah.
I mean, I can say that, and it maybe sounds kind of trite, but it was incredibly powerful for me. I mean, it really made me realize, like, this is beyond my comprehension, and I still can't comprehend it now. I remember at the time that I comprehended or I thought I comprehended what infinity was and the sugars. So I always thought they were very powerful. And the mescaline experience, we listened to music in this little jazz club in Cincinnati, and I just had wonderful colored visions floating around and just really enjoying music. And um, so I never thought they were really dangerous, but I knew they were illegal. I knew people you weren't supposed to use them, but of course, I was kind of anti-authoritarian by then. So it's like, well, as long as I don't get caught, So,
Oh,
uh,
okay. You're kind of my hero for the day. But I'm
so
not supposed to say that.
anyway, so when the Nixon administration they passed the drug law, um, the drug war, and he started it. It was just like, well, I had fun as a graduate student. I got to make a bunch of psychedelics. I published a bunch of scientific papers. This was cool. If I'm not able to do any more, then I'll do something else. But at least while I was a graduate student, I was having fun, and I never expected to be able to continue it. Well, then when I got the postdoc, I kept doing some of the pharmacology work with psychedelics. So now I had this history. And when I applied for my first grant through the National Institute on Drug Abuse, NIDA, it was really to study the structures of these. How do they work? Can we put them in
Mm.
animals? We worked with rats and mice and all. And I had the perfect background because almost no one was getting funded to do that work. And so here's a chemist. Well, we don't have any clinical trials, but this guy's going to use rats and mice, and he's going to figure out what is it that makes these compounds active. And so, I didn't really think about. I don't know if I ever really expected to get grant funded, but it was funded. And the interesting thing was when they wrote in those days, they would write up the background. I was the principal investigator, the person applying for the grant. So they said, Dr. Nichols has an excellent background. He trained with Charles Barfnack, who's well known for his work with psychedelics, and he's
Hmm.
published with animals, blah, blah, blah. So all the stuff I'd done really looked good on my background for the grant and there's nobody else doing it. So NIDA wanted to fund a grant in this area. Here was somebody who was doing it. Okay. They didn't fund many people to do that kind of work, but then it just once I had the money, nobody really cared what I was working on. Well, it was legitimate. It was funded by the government, so nobody thought, "Oh, he's working on these dangerous substances."
Yeah.
I remember thinking when I was a graduate student, when I was making all these psychedelic amphetamines, we put them in little vials and just stuck them in a drawer because they weren't controlled substances then. They weren't under control. And when I went down to get, we had to use alcohol for some solvent for some of our reactions. I had to sign a card, a little alcohol card. You had to have your professor sign an alcohol card. And I said to Dr. Bartnick one day, I said, "This is so funny. I'm making all these powerful psychedelics and just stick them in a vial in a drawer, but I have to get these cards signed and approved to get a bottle of alcohol."
Right. Sort of reminds me of when I was 40 years old and getting carded to go out and get a drink at a bar, right? There is irony in these sorts of things. Now, one of the things then that I'm hearing this trajectory and the National Institute of Drug Abuse funding allowed you to do was be able to actually study something that was illegal in a way that was credible. And in some earlier episodes of this series, we've discussed, well, some of the challenges associated with bringing credible research out to front with regards to psychedelic substances because they have been illegal and stigmatized for so long. Not to mention also, how do you, in light of a lot of the variables that are out there, let's say setting and setting, how do you make sure that the studies are clinically meaningful? As you have moved forward and your career has extended and expanded and been involved in so much in such depth, have you been able to transfer the knowledge that you had in that stage into building studies that are credible for where the psychedelic renaissance is taking us?
So the work that I did was with rats, mice mostly, and then of course receptor preparations. One of the assays they use now as a proxy for human activity is something called the mouse head twitch assay. If you give a psychedelic to a mouse, it'll shake its head like it's got a drop of water it's trying to shake it off.
Mm.
That's a poor reflection of what happens if someone takes LSD. I used a procedure called two-lever drug discrimination. We'd have an operant box with two levers in the front, a right and a left, and there would be a food pellet delivery trough in the middle. And we would train the rats. If we gave them LSD, we'd put them in there and we'd turn the right lever on. If they pressed the right lever, they'd get these little sugar pellets. They were sucrose, sugar pellets, literally. And if they pressed the left lever, nothing would happen. And then some of the rats, we'd train them on that way. Some of the rats, we'd switch it. We'd turn on the left lever. And if they got LSD, they would press the left lever. If they didn't get LSD, they would press the right lever. So over 2 months, you could train these rats to reliably press the lever that was associated with LSD. So then we'd make a compound and we'd put into rats and we say, well, does he press the lever he was trained on with the LSD with, or does he press the other lever? So we were using that. And actually, this rat two-levered is called two-levered drug discrimination. It's really a fairly powerful technique for predicting activity. But the rats became more and more expensive, so people switched to mice doing this head twitch thing. But the rats were much better. But I told people once, a rat telling us that he thinks we gave him LSD is just a very poor reflection of what happens in the human brain.
Yeah.
So we could generate data. Basically, though, what we would do is take the molecules that Sasha Shulgin had made and had tested in humans. We'd put those in our rats, and we'd see, well, the rats press the LSD appropriate lever. So we could use Sasha Shulgin's human data as a validating procedure for the data we got from the rats. But it became apparent at a certain point that we really needed clinical data, and there was no clinical data. The government quit funding clinical trials in 1976, I think. Johns Hopkins had the last LSD trial. It ended in 1976. There was nobody doing clinical studies. But I would go to these meetings and I would talk about psychedelics, and everybody there was like my age, and they'd all experimented with LSD and they smoked marijuana and whatnot. And we'd sit around and have a beer and commiserate about the fact that there's no clinical research. This was clinical research is what you really need. What do these do? And all the early ideas suggesting that psychedelics might be useful for treating, say, alcoholism or alleviating the pain of dying people, things like that. None of that was going on. So I would talk to people. There was a psychopharmacologist at UC San Diego, Mark Geyer, and Charlie Grobe was a pediatric psychiatrist at UCLA Harbor, and George Greer was a psychiatrist in New Mexico. And I'd go to meetings, I'd talk to these people, I'd say, somebody needs to fund clinical work. The government's not funding. I mean, what do you do? And I remember at one of these meetings, I was sitting talking to somebody, and I said, somebody needs to start a not-for-profit institute to fund this because the government isn't funding it. And I went home at that meeting. I was sitting in my rocking chair. I thought, nobody's going to do this. I'm going to be sitting in my rocking chair and be 90 years old or dead, and nobody's going to do it. I need to get some of these people and see if we could start it. And by then, there was the myth that the people in Silicon Valley had all experimented a lot with LSD, and maybe they'd be willing to fund this kind of work. It was actually a myth in the beginning. If those people had money, they didn't want to part with their money for the most part. But we did. We founded the Hefter Research Institute in 1993 with the goal of getting money from philanthropists and funding clinical studies, because that was a missing piece. I remember one of the first donors. I met his wife a few years ago, but we went to him. He was a real estate developer in California, and they gave us $10,000, and he said, no one can ever know where this money came from.
Wow.
And I saw his wife a few years ago. I said, do you remember when we got your first gift? And she says, isn't that strange? Things have changed so much now because you just couldn't do it. Our first big donor was Bob Wallace, who was the 9th employee of Microsoft.
Wow.
Once he was on the board, he came to our meetings and he had little note cards. He would write things down he would ask questions about the brain, how this worked, and how do nerves work, and how do neurons work, and all that. And he would take these cards and write them down. He always had a little pocket of these cards. So he gave us, I think, about $100,000 a year. He would cash in some of his old Microsoft stock.
Wow.
And so we were doing a little bit of work in the beginning. Then he died, unfortunately, a few years later. But we eventually started getting larger donations. We raised a total, as of the last year, I think we raised a total of $10 million. And that was basically put into, for the most part, clinical studies, like Johns Hopkins, as you mentioned, New York University, Charlie Grobe. And there's some other studies that haven't been published yet that we supported. But basically, that was the missing piece of the puzzle, was to get to clinical studies. And that, of course, has borne fruit, because once those clinical studies started appearing, then people realized, oh, you can do it. You just couldn't get government funding. You still can't get government funding for the most part, but enough philanthropists that had experience with these said, we need to support this work.
What makes a study credible? Audience members may be hearing all the time, well, this study and that study. And I ask this of you in particular because you were breaking ground. Like you said, I think you said your first grant was for $10,000. Now, later, of course, it's in the millions. But when you're starting out with these sorts of studies, again, considering the variability of the human brain and the circumstances within which people may be experiencing these substances, how do you guarantee that a study is something that is up to snuff and that could provide outcomes that are meaningful to people who might be making policy or legal decisions down the road?
Well, the first thing you have to do is you have to find a site where the study can be done and experienced investigators. So, for example, Charlie Grove did an early study of cancer patients, and he had done earlier studies, clinical studies, so he was familiar with how to set up a clinical study. But in the beginning, in those studies, there was a lot of time spent, sending a protocol in. They'd get it back from the FDA, to revise it, they'd send it back in. In the beginning, the institutional review boards were reluctant even to look at these things because you want to do a clinical study. They had to go through a lot of vetting. I know Rick Strassman, when he gave DMT, he actually published a paper on all the hurdles and hoops he had to jump through in order to get approval to give DMT to humans. So it was a lot of rigmarole. But Strassman was a MD, a psychiatrist at University of New Mexico. Roland Griffiths was a PhD psychopharmacologist with MDs at Johns Hopkins. But Steve Ross and Tony Bossis and the people at New York University were MDs, PhDs in clinical psychology, etc. So you have personnel, and then once you have a template, like once Charlie Grove's procedure was written up, then we shared it to other people. So, well, here's what Charlie Grove, here's how he got approval. Here are the things that he had to put in that his institutional review board wanted. So it has to be carefully vetted. Protection of subjects is paramount. You want to make sure, above all, do no harm is kind of the dictum of physicians. And then getting money is the big problem. Most of the early studies, they didn't, like Charlie Grove didn't take a salary. He worked on weekends with a nurse, so that he had a small room. In Johns Hopkins, I don't think they didn't draw a salary to doing the study. Basically, it was paying for clinical backup, rent of the room, things like that. But and then a placebo control, which is very difficult to do with psychedelics. You're supposed to do the study, so it's a randomized placebo controlled study. So that's the gold standard, randomized placebo controlled study, and it's very hard. Roland Griffiths for placebo used high doses of, I think, Ritalin, methylphenidate. Mike Bogenschutz in his study of alcohol used to use high doses of Benadryl. And these, if you know, most of the people, well, I think Mike Ross, Benadryl, he gave large doses of Benadryl. They didn't know what the effects of a psychedelic were. If you had somebody that's had a psychedelic and you give them Benadryl, they're going to say, well, yeah, I don't know what you're doing. But so
Yeah.
so you have to have it. It has to be blinded so that the person doing the study doesn't know who got the real drug. So you do placebo capsules that look exactly like the psilocybin capsules. Um, Nobody knows until you break the blind. Nobody can know who got what until the study's all done, and then everybody's coded. The drugs are all coded, and you put it all together. You do the analysis. You do everything to keep from biasing or confounding the data. But the studies, I mean, even small studies can be done well. Drug companies, if they have a drug for, say, hypertension, they might enroll 500 or 1,000 or 2,000 people. These are all small studies that had 11, 15, 20, 30. I think Mike Bogenschutz's was the biggest study. I think he had 96, an alcohol use disorder he did at New York University. They're all relatively small studies.
Although I have to say, one thing I don't know that is clear to the layperson and that you have revealed to me is that even if these studies are privately funded, there's an interface with the FDA or some other regulatory entity before they can be finalized, executed, and all of that sort of stuff. So it's not like you get the money and then you just go off somewhere, which is the impression that I might have had being a non-scientist, and then you do these experiments following your own protocols like something out of a sci-fi movie. Right. This is a highly regulated process. And I say this because when people hear about privately funded studies, it's not done within government funding structure. Well, nonetheless, it's not like the safety net that the government regulators provide isn't there. And so that, to me, especially again, when you think about the fact that you described also that these government regulators were looking at who was conducting these studies and what their CVs were, bolsters some of the uh, validity that a layperson like me might be able to attach to these sorts of studies when you hear about them, and that's a big deal.
Yeah. So you really, to do the study, you need to understand how a clinical study is done, what kind of safeguards you need, data protection, all kinds of things. So then all the institutions that we worked at academics, they have an institutional review board, an IRB. The institutional review board takes that first protocol and looks at it and says, you want to give these drugs to humans? What are you doing to protect them? How safe are these drugs? So you have to provide a lot of background. And then if they approve it, you have to also then go to the FDA, because the FDA won't let you give drugs to people unless they approve it. So then there's a pilot drug evaluation group at FDA that goes through and they look at what you propose to do. And they may come back and say, you need to change this or you need to change that, or this won't work, or you need to do this. So you work with the FDA. They come back. If they make changes, then you go back and you resubmit your revised protocol to your institutional review board. But basically, there's a lot of vetting. It'll take you a couple of years probably before you can give a drug. Then you have to get a source of the drug. Well, that was a thing that happened like with Rick Strassman. He wanted to do DMT, and I had done I'd made the MDMA for Rick Doblin and MAPS for their first two phase studies, phase one, phase two studies, and I had never worked with FDA before. So he came to me and said, I'll put you in touch with an FDA chemist. So I talked to the FDA chemist, like, what do I need to do? How do I need to do it? They need my CV, they need a description of the physical space, all the reagents and chemicals we use. We need to say where we got them, what the purity was. We need to analyze everything, have all kinds of analysis of intermediates and so forth to do that. So then when Rick Strassman came to me in the early 90s and said, I can't find anybody to make DMT, I said, well, I made the MDMA for Rick Doblin. DMT is an easier molecule to make. So then we did the same thing. I went to the FDA, said, okay, here's what I propose to do. So that worked. And then by the time we got to the psilocybin for Johns Hopkins, then I sort of knew how to do it and had done it and did it a couple times.
I have to say, again, for a layperson, just saying casually, oh, and I made the psilocybin, I made that, it's pretty astounding. But what's even more astounding about this is that the rebellious little boy who chose a radical, for the time, subject to devote his life to, has now lived to see all of this going to a different level. You chose to take action, you said earlier, not just sit in your rocking chair until you were 90. Let's talk a little bit about the heart here, David. How does it feel, looking back on it all, to see where things are going now?
It's kind of unbelievable, really. A woman asked me a few years ago, she said, where do you see, and this was 5 or 6, 7 years ago, I don't know, and she says, where do you see this field going? And I said, well, someday, probably long after I'm dead, you'll be having a midlife crisis, and your primary care physician, your doctor, will send you down to the shaman/psychiatrist at the corner, and you'll do a psychedelic session, and you'll get a new perspective on your life, and you'll get a new view of the way things are. And she says, oh my God, you think you'll be dead by then? I said, yeah, probably, but if the vector's pointing in the right direction, that'll be okay. And it's kind of like when I see this now, I can't even keep. I used to keep track of the publications that came out on psychedelics. I can't keep even track of them anymore. I've got thousands of them stored in a PDF as PDFs in a folder on my computer. The idea that MDMA may be approved, maybe when they're going right now, we'll see, for treating PTSD. Psilocybin is probably going to be approved for depression, maybe end of life. There are 2 or 3 clinics now, hospice clinics, that are experimentally using psilocybin for dying patients. I mean, I think it's tremendous, that I was able to have some influence in that happening, that I was able to provide some of the impetus. And I encouraged a lot of people. And maybe if they looked at me and said, well, when I invited Roland Griffiths to join the Hefter board, he and I were both in the American College of Neuropsychopharmacology, ACNP it's called. And we went to meetings, and I knew of him. He was working on caffeine. And I knew of him. And then when he got involved in doing some psilocybin work, Bob Jesse had got him interested in it. And then I approached Roland and said, how would you like to be on the board of the Hefter Research Institute? He said, well, tell me a little bit about Hefter. What do they do? Yada, yada, yada. He says, yeah, let me think about it. And then he got back in touch with me later on and said, I was thinking, you're a tenured professor at Purdue. You're not going to be, and I wondered about what was this Hefter Institute. But then I thought, Dave's a tenured professor at Purdue. He's not going to do something that destroys his reputation in his life. So it's probably okay. So he says, I'm going to join Hefter. And so he became a member of the Hefter board and helped us, direct things. So, the fact that I did it, and I was such a, really a conservative person in terms of, I never really was much into self-aggrandizement. I didn't advertise what I was doing. I kept things under the radar, as I would say. I didn't want to call attention to what I was doing at Purdue. And now to see this, the way the whole thing has changed. I mean, it still has a long way to go, but I never thought I would see this happening in my lifetime. It's amazing.
It really is. And hearing your journey has opened my eyes to the full extent to which change can happen within a lifetime. As we wrap up, I've got one final question. David, what are some frontiers of psychedelic study that you see us moving into possibly in the future?
I don't think it's understanding the receptor and how psychedelics affect the brain so much, but really using these things as tools to understand how the human brain generates the mind and the human mind. I mean, look at all the wars and everything going on in the world today. More people have been killed in the name of somebody's God than anything else. And if we can use these to heal people, figure out how to make their minds work properly and view everybody as another human being, I mean, I really think the possibility exists, and Rick Doblin would go along with this. I really think the possibility exists that we could change the nature of humankind if these things really became widely used and exploited properly for all kinds of psychiatric illnesses. I mean, I think we're on the threshold. Well, there's a Moody Blues song, "On the Threshold of a Dream." I think maybe it was an album. I think we're on the threshold of a dream. I hope so.
Wow. And one of the things that reinforces and that I will share as my final takeaway is that the scope and the scale of this dream, I mean, you're talking about literally global social, political, cultural changes that can start at an individual level, but can literally impact things like war and the fates of entire societies. When I first started recording this podcast as someone who wasn't from the psychedelic space, if I had heard someone say such a thing, I would have thought it was ridiculous. One of the things I've learned to truly understand through this journey, getting to listen and learn from people like you, is that not only are dreams possible, but they can be more expansive than any of us think. Thank you, Dr. Nichols, for not sitting in that rocking chair until you were 90. If there is one last takeaway or one last thing that you'd like to share with the audience, please give it to us.
um, expect the unexpected sometimes.
That's a mic drop. Dr. Nichols, how can people find out more about you and your work? They're going to demand to be doing so after this interview.
I mean, if they type David E. Nichols into Google, I've given lectures. And they'll find publications I'm on. So that would be the place to start. I've given a lot of lectures at conferences. They could listen to me give lectures about psychedelics. So, I mean, that would be the place to start.
I love that you make it easy. And by the way, if you're listening to this episode in a few years, it might be just typing his name into ChatGPT, right?
Could be.
So for those of you who have listened to or watched this episode and enjoyed it and pulled as much from it as I have, and I know everyone who did listen or watch this has pulled a lot from it, make sure that you share what we're doing here at Webdelics with everyone that you know. Also, take the time to subscribe to this show on your favorite audio platform or on YouTube, and then make sure that you like this episode if you are on YouTube, and leave us a 5-star review on your favorite audio platform. Then follow us on all of our social media accounts: Instagram, LinkedIn, Facebook. Also, go to our website, webdelics.com. That's WEBDELICS.com. And sign up to our blog for trusted and credible information that's up to date about psychedelics and plant medicine. Then, above all else, be sure to come back next time for another episode of the Webdelics podcast.